This week on the Wheelhouse. What happens when science meets politics and our health is on the line? For Connecticut Public, I'm Frankie Graziano. This is the Wheelhouse, the show that connects politics to the people. We got your weekly dose of politics in Connecticut and beyond, right here. It's been a turbulent few months at the Centers for Disease Control and Prevention. Under Health Secretary Robert F. Kennedy Jr., the agency's new director was fired, and several other top officials resigned. One of our guests today calls this moment probably the most tumultuous time in the CDC's history. So what does that mean for you, for me, and people across Connecticut? And what's in store for vaccinations this fall as flu season begins? Joining me now, Apoorva Mandavili, science and global health reporter at the New York Times. Apoorva, thank you so much for being here. Thank you for coming on the Wheelhouse.
Thanks for having me.
Also joining us, Dr. Lynn Sosa, Infectious Diseases Director for Connecticut's Department of Public Health. Dr. Sosa, great to have you on the show.
Thanks for having me as well.
Folks, if you have any questions about your access to vaccinations, join our conversation. Call us 888-720-9677, 888-720-9677. I'm also trying to moderate our YouTube conversation here as we stream live at youtube.com/Connecticut Public. So hit us up, youtube.com/Connecticut Public. Apoorva, we'll dig into vaccines a little later in the show, but let's start with the Centers for Disease Control and Prevention, the CDC. Dr. Susan Menarez served as its new director, recently fired. First of all, tell me about Dr. Menarez, and as we could see throughout this recent confirmation hearing, sorry, I'm always thinking about that when we're talking about Capitol Hill, but at least when RFK Jr., Robert F. Kennedy Jr., was grilled on Capitol Hill, we can tell that the Menarez sort of confirmation or her appointment necessarily was very controversial at the time.
Well, she was probably one of the better candidates for the job. I think people were really worried about what kind of person Mr. Kennedy would appoint in that role. And she's an infectious disease expert. She has a lot of experience in federal agencies. She's a scientist. And in her confirmation hearing, she said she supports, that she supports vaccines. So she was not a controversial choice from that perspective at all. And I think she became controversial for Mr. Kennedy specifically because he didn't like her views in the end.
And it was Elizabeth Warren, who's a senator, that was worried whether or not, and I think this happens with anybody in this new administration, there's concern whether or not they would be partisan or at least would have to back down from a recommendation. And it seems like that we had from one of the members of the administration, but it seems like that didn't happen with Dr. Menarez. She was against some of the policy changes that we had under Robert F. Kennedy Jr. Is that correct?
That is correct. Although there is some he said, she said here where yes. Mr. Kennedy claims that none of this happened. But what Dr. Menarez says is that he asked her to essentially rubber stamp any decision that comes out of the vaccine panel, which is at the moment filled with advisors that he chose who sort of share his vaccine skepticism. And she apparently refused to go along with that. And she also refused to fire some top CDC officials that Mr. Kennedy had wanted her to do. And that essentially that was her undoing. That's when Mr. Kennedy decided that he didn't want to keep her around.
And that's the point. There was some conjecture about whether or not she was fired. She's gone either way. And is that the point that some of these top scientists here, or some of these folks that are maybe advocates for science, are no longer in RFK Jr.'s way here?
Not just some. I think there are a lot. We've lost thousands of scientists from the CDC, from the FDA, from the NIH, and even at the CDC itself, which is the agency that I cover most closely. There are so many people who are now gone who had very valuable expertise in things like infectious disease, HIV, STIs, but also, food safety, in chronic diseases, in all kinds of areas. And the nation will be poorer for that because Mr. Kennedy won't have access to that kind of expertise.
Dr. Souza, how does this turmoil happening in Washington, D.C. impact Connecticut's Department of Health?
Yeah, it definitely is affecting us on a lot of levels. And I think it's the uncertainty and the fact that things are changing so quickly that it's really been challenging for us to keep up with. So I think people might not always realize that public health has always been here to keep people healthy and keep people safe. And it's really kind of that invisible work that public health does that's always been there. Maybe people just kind of started realizing that during the pandemic. But we've always been here and CDC's always been here. And so it's really important that that continues. A lot of this turmoil in terms of the federal government, people might not realize that about 80% of the funding that we receive is from the federal government. And those funds are really important for making sure that we can continue to do the work that we do. We get over 100 grants, primarily from CDC, to do things like disease surveillance and outbreak detection and contact investigations and things like that. Luckily, we have not lost any major funding yet, but we are trying to prepare for that and trying to prioritize the work that we do, focused first on the things that we're required to do by statute, as well as making sure that we can maintain that safety net. So it's definitely challenging times right now.
When you say prepare, what does that mean? Does that mean that you may have to ask state lawmakers to help you out to make up that money if it goes away? Or is it at least you'll try to make sure you could kind of backfill if you need to? What does prepare mean in that case?
Right. I think that all of those things are possibilities. I think we want to make sure that we're continuing to fulfill our core functions, right? So, for example, for me as the infectious disease director, one of our core functions is making sure that we're monitoring disease trends and detecting outbreaks. So that's really, really important. And then when we actually find an outbreak, making sure that we're able to respond to that, making sure that we're finding people that are exposed, offering them treatment if that's available, and making sure that we can continue to be that safety net. For example, our state public health laboratory is important for making sure that if a healthcare provider thinks that somebody has measles, we can make sure that that person can get that measles test as quickly as possible. So those are the types of things that we're focused on right now, making sure that we know what those things are. And then if we do have issues with funding or have cuts, we're able to handle those.
Connecticut's Governor, Ned Lamont, is exploring ways to require insurers to keep covering COVID-19 shots, despite new federal guidance limiting access to people with risk factors, those 65 and older as well. Let's listen to what he shared at a Capitol News briefing earlier this week.
You could have an executive order. You could say, we're working with the pharmacies right now to see how far we can go. Say we want the pharmacies to be able to provide the COVID vaccine to anybody that wants it and needs it.
Dr. Sosa, Massachusetts requiring insurers to pay for COVID vaccine, and I think that's kind of what folks are trying to ask of the governor, or if he's going to do that. What's your understanding about whether or not that's something that Connecticut can do?
Right. So I think from the perspective of the Department of Public Health, we want to make sure that people understand, what the recommendations are and what our recommendations are for who should be receiving COVID-19 vaccinations. And we have released interim recommendations on that, similar to what you saw from New York and New Hampshire. So that's been our first priority. And then working with the governor's office to make sure that then people who should be getting the vaccine are able to do that.
Do your guidelines differ from the 65 and older and I guess the people with risk factors crowd? And I'm imagining that the risk factors are sort of limited to maybe multiple comorbidities or something like that. Do you have a different sort of guidance than what we got from the federal government?
Right. So similar to what you've seen to other states, our guidance, as vaccine guidance always is based on the best available evidence. You have seen certain organizations like the American Academy of Pediatrics, the American College of Obstetrics and Gynecology, and more recently yesterday, the American Academy of Family Practice come out with their recommendations. And those are what our recommendations are based on. So making sure that the people that are certainly at the highest risk for severe complications and death from COVID-19, that's very young children, that's older persons, that's people at the highest risk, definitely should get the vaccine. But then also making sure that people who want to get the vaccine can.
Okay. A spokesperson for President Trump, Kush Desai, said in an email that Dr. Menares was not aligned with the president's agenda of making America healthy again. That's what we're talking about in terms of the federal stuff, Apoorva. Do we know which portions of the president's Make America Healthy Again MAHA agenda Dr. Menares was sort of challenging?
Vaccines. I mean, she was only in the job for just less than a month, so she didn't really have a chance to not be aligned in many ways. Vaccines were really the main, I think, bone of contention between her and the administration. Mr. Kennedy has been very clear about how what he thinks about vaccines. He thinks that they are potentially dangerous. The COVID vaccine in particular, he's called it the deadliest vaccine ever made. And I think she did not necessarily agree with those views. And she didn't want to go into the sort of vaccine recommendation process with preconceived ideas. She wanted to wait and look at the evidence and then make a decision. And from what she has said, he wanted her to go along with whatever decision that he had already had in mind, regardless of the evidence. And I think she was just not willing to go along with that.
Menares isn't the only one who's gone. We talked about folks being gone from NIH, also the FDA, at least in terms of the CDC. What kind of big names or at least big scientific brains are sort of gone from there?
Yeah, so the CDC has 11 center directors who are right under the director, and a lot of those people are gone. They were either put on administrative leave in April when there was a big reorganization of the agency, and then when Dr. Menares left, 3 other center directors also resigned. One who led the data center, one who led the infectious disease center, and one who led a center for emerging infectious diseases. So these are things that we really want some leadership in. And then also the chief medical officer of the agency, who's sort of the liaison between the CDC and the Department of Health and Human Services. She oversees a lot of the work at the CDC. And so 3 of those people left sort of in protest of everything that's been going on at the agency, and they left at the same time as Dr. Menares, and one had resigned the day before. But that was a sort of big exodus of very, very important people, and they're important, but also really beloved. I mean, I talked to a lot of CDC people, and some of them had viewed these particular scientists as mentors, and they're really shaken up by what happened. And of course, this is all coming on the heels of the shooting on the CDC. So things are not feeling very stable within the agency.
Absolutely a tumultuous time right now within the agency. So then, Dr. Sosa, we had that transition to sort of be able to come back to you and then ask you, is Connecticut in alignment with the president's Make America Healthy Again agenda?
Yeah, so I think keeping people healthy is not political or partisan. As I mentioned, public health has always been there to keep people healthy and protect them. They just haven't known it. All the things that public health does has often been in the background because that's what prevention is. It's the things that you can do so that you never get sick or hopefully never get sick. And so public health is going to continue to do that.
Does the state have the ability, do you think, to enforce policies that may not necessarily align with the federal government's stance? Or like if you have concerns about how vaccines are being doled out or are being covered, what kind of power do you have to be able to facilitate change?
I think that's what you're seeing with the governor's statement that you played earlier today. We're trying to figure out what we can do, and that might differ from state to state. And I'm sure that Connecticut will figure that out very soon.
Is there a concern that you mentioned that being healthy is not political? Is there a concern from your perspective as an epidemiologist that it is becoming too political?
Well, I think it's just making sure that people understand like what is public health here to do and how it's always been here to serve people, to keep people healthy. So for example, again, from the infectious disease perspective, one of the things that we do on the regular basis is monitor for different types of diseases. Foodborne disease detection is one of our main responsibilities, and that's actually something we work with CDC really closely on. So, for example, we report to CDC when we find certain cases of foodborne illness, and CDC is really important in being able to connect reports that different states make to them. And then they are able to use that information that they have have to say, hey, Connecticut found a couple of people with this strain of salmonella. We're also seeing that in Colorado. They're able to help make those connections that can eventually lead to food recalls if that's needed, and keeping everybody safe and keeping the food supply safe. That's just one example of the things that we do on a regular basis and that we're going to continue to do.
So the takeaway that I'm having from this interview with you is that no matter what happens, no matter how political things become, a relationship that has to really foster public health between a state and the federal government really relies on the state Department of Public Health or whoever just having a really solid back and forth, being able to work every day with the CDC.
Absolutely. We talk with them every day. We talk with our counterparts and our colleagues in other states every day. That's something that we've always done. And we're obviously doing even more during this time to navigate all of these challenging all of these changes and the uncertainty. And that's something that we're going to continue to do. But I cannot overstate the importance of having the CDC there to help kind of make sure that we have a national and coordinated public health response, because that's really important. It helps us to make sure that, again, that we can detect outbreaks, that we can understand that there is an outbreak, not just in our state, but affecting kind of all of the country. But they also do so many other things in terms of making sure that we're safe from emerging diseases. So, for example, when the Mpox outbreak happened, Mpox was not a new disease to CDC. They had actually seen Mpox before. They'd actually dealt with an Mpox outbreak in the early 2000s related to imported prairie dogs. So when Mpox actually came here in a different way, right? It was new in that way because we had not seen it kind of spread in that way that it did in 2022. CDC was the expert that we relied on because they had that experience and they could share that and help us make sure that we were responding as quickly and efficiently as possible. That's not only on testing, but making sure that we had treatment and vaccines available. The other thing, and this is just another example of the importance of CDC, is that they are really important in terms of workforce development. So I actually started my public health career as an epidemic intelligence service officer, or EIS officer. And that's an applied epidemiology training program for physicians and scientists that's been at CDC for over 70 years. So this is a 2-year training program that helps clinicians and scientists learn how to be public health practitioners and help them learn to respond to outbreaks, and sometimes they're assigned to a state or local health department. I was assigned here to Connecticut, or they can be assigned at CDC, and then they can be deployed based on whether a state or sometimes another country asks for help. So this is really important because this group has become the leaders in public health, both in state and local health departments, but also in hospitals and other healthcare settings. And CDC has actually created other training programs that are modeled on this EIS program for undergraduates, for MPH level folks, for all level of public health practitioners. And so without CDC being able to manage these training programs, we're going to really lose our pipeline of public health leaders, and that is going to affect the health of our nation in the future. So those are just a few examples of the importance of having CDC at that national level.
And very important for us to all monitor that relationship between the state and this federal government agency. Apoorva, Jim O'Neill, a former biotechnology executive, is now the agency's acting director. What do we know about O'Neill?
Well, he's not new to the federal government. He was also part of the health department under President George W. Bush, but he has spent some time in Silicon Valley in between. He's said to be very close to Peter Thiel, and he, from what I can tell, does not have a very strong background or at all in health. And so it's a little bit unusual to have somebody be the acting director of the CDC when they have not actually done any health work themselves. They're not an epidemiologist. They're not a medical doctor. They don't really understand medical research. So it'll be interesting to see how that plays out and how long he'll be in that role. It's a little bit difficult to see who they might bring in as the new permanent director, because from what we can tell from the two directors that have, or the nominees that have come in, it's going to be difficult to find somebody who pleases both Mr. Kennedy and the Senate that has to approve the nomination. So Mr. O'Neill might be in that role for quite a while, and we don't. He has said that he does support vaccines, But he has also said that he really supports Mr. Kennedy's agenda and his efforts to make America healthy again. So we don't know quite yet where he'll fall on the vaccine issue, but chances are he will go along with what Mr. Kennedy wants.
I hate to do this, but I'm all about nuance on this show. So I'm going to try to do this quick with you. Peter Thiel, you said that name. Let's close the loop on that. Peter Thiel is important because for some folks that might not know, this is somebody who is accused of being a tech bro. You could call him a tech bro. I understand that. And really into science fiction. So we bring this up because people are concerned, obviously, about the future of America, where it's going. When we talk about these tech bros, sometimes we hear about eugenics and things like that. Is there anything we need to be concerned about with that connection between O'Neill and Thiel there?
I don't really want to speculate on that.
Okay, that's fair, but I just wanted to bring that up at that point.
But he's a very big donor to the Republican Party, and so Peter Thiel does wield a lot of influence. And so when you see somebody like that, someone who's aligned with him come into government, it is a bit of a signal that there might be outside influences now on what the government does.
Thank you for doing that in some sort of way so that we can kind of close the loop on that. The CDC historically relies on science, not science fiction, but science, right? Meaning it hasn't worked specifically in service to the executive branch of the federal government. Help me define the current moment and how it sort of differentiates from years past.
Well, I want to sort of add to something that Dr. Sosa said, which is that the states really rely on the CDC for guidance. I think that's a big piece of activity that the CDC does that's going to be lost now. And the other part of that is that I think a lot of people maybe don't realize that about 80% of the CDC's budget goes to states. You know, one of the criticisms of the CDC has been that it's bloated, that its mission has really expanded beyond its scope. And I have spoken to some experts who somewhat agree with that and think that the CDC can actually use reform, and maybe there's some overlap. But they also do think that everything that the CDC does is really valuable to the states. And, you know, it's not just food safety, as Dr. Sosa talked about, or infectious diseases. No state can have all the expertise to deal with its residents' health problems at the local level. And so it's been very important for them to turn to the CDC. So what I see now is state officials and local officials being extremely nervous about these developments because for the first time in a long time, they're facing a situation where they will have a lot less money. Many of them have already laid off people at the local and state levels. And also they're going to have a lot less expertise from the CDC. So we're asking them to make more decisions on their own. And at the same time, we're giving them a lot less money. And so there's going to be a big fallout that we will see at the state and local levels. We haven't quite seen it all yet because we're still operating under last year's budget for the most part. But when the new budget kicks in and we see the effects really play out, I think we're going to see some major effects at the state and local levels.
From Connecticut Public Radio, this is The Wheelhouse. I'm Frankie Graziano. You've been listening to science and global health reporter at the New York Times, Apoorva Mandavilli, and infectious diseases director and state epidemiologist for Connecticut's Department of Public Health, Dr. Lynn Sosa. After the break, which immunizations are being reviewed by the Vaccine Advisory Panel, and how should families in Connecticut prepare as we enter flu season? Give us a call, 888-720-9677. 888-720-9677. Send us a comment on YouTube as you're watching the stream, youtube.com/Connecticut Public. You're listening to The Wheelhouse. This is The Wheelhouse from Connecticut Public Radio. I'm Frankie Graziano. Leadership at the Federal Centers for Disease Control and Prevention has shaken up, raising new questions about the stability of the nation's top public health agency. This hour, we're looking at how this upheaval could ripple down to Connecticut. Still with us, infectious diseases director for Connecticut's Department of Public Health, Dr. Lynn Sosa, and science and global health reporter for the New York Times, Apoorva Mandavilli. Do leadership changes within the CDC affect the way you make decisions for your family? Give us a call, 888-720-9677. Hit us up on YouTube as you're watching our live stream, youtube.com/Connecticut Public. Apoorva, a vaccine advisory panel newly established under Health Secretary Kennedy Jr., will revisit childhood and adolescent immunization schedule soon. What are some of the vaccinations included on that list to be reviewed?
So I just want to clarify something really quickly. The panel itself is not new. The members are new. This is the same panel that has always made recommendations for which vaccines Americans should take. But now the members all seem aligned with Mr. Kennedy's views on vaccines. And on next week, they are supposed to be looking at a few different vaccines, definitely COVID-19 vaccines. They're supposed to vote on that. But we don't expect any surprises there. Most likely, they will just go along with the restrictions that Mr. Kennedy and the FDA have already spelled out, which is that people 65 plus and only people with multiple other conditions will be able to get the vaccine or should get the vaccine. That's what they're expected to recommend. A lot of the experts that I talk to are extremely worried about something else that's on the agenda, which is the hepatitis B vaccine. That's a vaccine that's given at birth to prevent hepatitis B, which can be a very horrific disease and can be fatal. The argument that some people have made is that because this disease is mostly sexually transmitted, we should not be vaccinating every child at birth. But there are very good reasons to be doing that, including the fact that it's not only sexually transmitted. And so there are some concerns that the panel will revisit that vaccine, possibly take it off the routine immunization schedule, possibly delay the time at which it would be given. And so there's a lot of concern around that vaccine. They're also looking at a couple of other things, including some preventive products for respiratory syncytial virus, which is a leading cause of hospitalization for young babies. They had already voted actually to allow that and in June when they met at their first meeting. But since then, a couple of the members have said that they feel they were lied to at that meeting and that there's new data that they didn't know about and that they're going to revisit that. So we don't know what's going to come out of that.
Robert F. Kennedy Jr. has promised that there would be answers on the causes of autism this month. Why is that timeline? Why is there this pressure to solve autism here as the federal government seems to be trying to do here?
You know, it's a good question. I think people have been trying to figure out the causes of autism for quite a long time. In fact, before I joined the Times, I worked for a research organization that funded autism research, and we covered it every single day. And there are not really clear answers quite yet, except we do know that there are some genes that seem to be implicated. But we also know that Mr. Kennedy has said on many occasions that he thinks the vaccines have something to do with causing autism. So we expect to see definitely something along those lines in this report. I think that's something that he has promised his base for quite a long time, that he's going to get to the bottom of this. And he sort of self-imposed this deadline of September 15th that he was going to have an answer by then. And he has appointed a couple of people whose job it has been to look through a lot of vaccine safety records and other data and to come up with the answer.
But this is important. This is where it's kind of important to look at the rhetoric, right? I think I'm trying to remember the word off the top of my head here that President Donald Trump said. But I think the rhetoric that he used is that they're trying to figure it out, but it seems like there's something inorganic may have been the word that he used. There's some kind of word that the president has been using, and why I'm bringing this up is that folks are trying to read through the tea leaves to see where RFK Jr. is kind of going with all of this in terms of autism and maybe even vaccines.
Yeah, there's some sense that he may include vaccines in this report, but also maybe some ultra-processed foods or something dietary. We're hearing a lot of rumors, but until we see the report, it really won't be clear exactly what they have decided is the solution or the problem, rather.
Robert F. Kennedy Jr. questions the legitimacy of science behind vaccinations for things like chickenpox, Dr. Sosa, measles, mumps, rubella, hepatitis B, and more. From your understanding and the state's understanding, Dr. Sosa, is there reason to question the safety of these vaccines?
No, there's not. I think the guidance on vaccines has always been based on the best scientific evidence for their effectiveness and usage, and that evidence is constantly being updated as studies are conducted and as new vaccines are developed and brought to market. CDC and the ACIP have historically played that critical role of making sure the most up-to-date evidence is available for making vaccine recommendations. The other thing I wanted to make sure everybody knew is that systems have been in place for many years to monitor safety of vaccines after they are brought to market and available to the public. And these systems are there to detect an issue or a potential issue with the vaccine so that those concerns can be investigated quickly. I can give you an example. So there's a virus called chikungunya virus. It's a virus that is a mosquito-borne virus. It is very common in other parts of the world, especially tropical parts of the world. So people traveling to those parts of the world might be exposed to it. It's a virus that causes severe body aches, pains, and fever, and can cause more severe illness, especially in older persons, and including sometimes death. So at the ACIP meeting in the spring, CDC provided information from the Vaccine Adverse Events Reporting System, or VAERS, about reports of people who had severe complications after receiving one of the two available vaccines against chikungunya virus. So VAERS has actually been around since 1990, and it's meant to serve as an early warning system for possible safety problems for licensed vaccines. So once those issues were detected, FDA actually suspended the approval of one of the currently available chikungunya vaccines. So this is really a perfect example of how the normal routine process of approving and recommending vaccines, part of that process is also monitoring the safety of those vaccines.
Robert F. Kennedy questioned last week, Apoorva, by his colleagues, including Republican senators, during a contentious hearing before the Senate Finance Committee. He faced pushback and questions over vaccine policies and the recent firing of the director of the CDC, Susan Manaras. What do you anticipate that we'll see play out in D.C. over the next coming months here? And will there be more contentious sort of moments here, Apoorva?
Absolutely. In fact, last night, Senator Cassidy announced that Dr. Manaras will come before Senate next week to talk about her side of what happened. So already we're starting to see that they are digging deeper into the actual circumstances of her firing. And also, I think as Mr. Kennedy goes further down this path of vaccines and his committee, the committee members that he's appointed maybe revise the immunization schedule for certain important vaccines, the senators are going to get more and more upset. We started to see even in this last hearing that Senator Cassidy, who was initially very supportive of Mr. Kennedy, and even though he had some doubts, did vote in his favor, was starting to get very agitated. We saw another Republican senator who has actually always been very supportive, Senator Barrasso, also saying, that he's very concerned about these activities on vaccines. And so I think you're starting to see some real concern on the side of Republican senators. So far, that doesn't seem like it really affects Mr. Kennedy's relationship with President Trump. Mr. Kennedy comes with his own big base, and he seems to have a very special relationship with the president. So none of this necessarily means that Mr. Kennedy's role is in jeopardy, but I think his relationship with the senators is definitely frayed.
There are a lot of questions about the CDC and whether or not it can sort of survive this whole thing. Is that relevant to the conversation of whether or not it actually does survive, or is the concern that this is just going to be much different and it not necessarily will crumble, but it will just be an agency that doesn't really interact with the states and also doesn't provide important funding to prevent illnesses? Are we more worried about the infrastructure covering or about the CDC just looking much different in the future, Apoorva?
I don't think it's so much the CDC looking different or having, different institution names or center names. I think what we're really concerned about is whether the CDC can function in its traditional role in guiding states, in being able to be the source of really science-based information. I wrote about this recently, about whether the CDC can survive this moment. And when I started reporting it, I fully expected that the people I talked to would say, "Oh, you're overreacting. It's all going to settle down." And pretty much everybody I talked to said that the CDC is sort of on its deathbed, the CDC as we know it, and that we may never recover from this moment, because the thing that makes the CDC so powerful is its credibility, and that is what it's losing at this moment.
I need to know, I guess, Dr. Sosa, are you preparing for that eventuality? Is that sort of a hypothetical at this point, or is that something that you can kind of work on here as you prepare for the next coming months, and obviously trying to worry about maybe the next pandemic or whatever is always going to be around the corner in terms of a menace to public health?
Right. So, as I mentioned, CDC has really been critical for making sure that we have a coordinated public health response, whether it's emergency response, whether it's routine. And we're certainly still hoping that CDC can do that. And we know so many people that work there, many colleagues, many of those people are friends. You will find no more dedicated workforce than people who are in public health. And the people that are there are still trying to do that. At the same time, as often as we talk to our colleagues at CDC, we talk to our colleagues in other states across the country. And certainly because we're so small in the Northeast, we talk to our colleagues in the Northeast on a regular basis, and certainly even more as we try to navigate these challenging times. So I think, as we see what happens with CDC, we're going to continue to rely on each other so that we can make sure that we are continuing to fulfill our core public health function and keeping everybody, protect everybody from public health threats.
So then let's finish off on this note. What should families in Connecticut know about vaccines this fall? Will they still have access to a COVID booster, flu shot, and everything else they've historically had access to? Will insurance cover it? Is there any kind of update you can give us on that?
Sure. I think our main role right now is making sure that people know what vaccines they should be getting. And so, as I mentioned, we have released interim COVID-19 vaccine guidance, making sure that people know that what they should get. And that includes really young people, really older people, people at highest risk. And I think the other thing to remind people is that we are very fortunate in Connecticut. We have our Connecticut vaccine program is one of the strongest vaccine programs in the nation. It provides all recommended vaccines to all children. This has resulted in us in Connecticut having the highest vaccine rate for the measles, mumps, rubella shot for kindergartners at 98.2%. So that's really important. And I think, that has translated to the fact that Connecticut is one of 8 states who has not had a measles case this year. We're certainly prepared if that should happen, but I think it's really important to show that those high vaccine rates are keeping the people of Connecticut safe.
And those records do continue to matter, so I appreciate that work. Thank you so much for bringing that up. You've been listening to Dr. Lynn Sosa, Infectious Diseases Director for Connecticut's Department of Public Health. Dr. Sosa, thank you for coming on the show.
Thanks for having me.
And Apoorva Mandavili, Science and Global Health Reporter for the New York Times. Apoorva, I am so grateful for your time this morning.
My pleasure.
A very delicate conversation where you're trying to navigate around politics to have a very important public health conversation at a time where we need information and not misinformation. Thank you so much to both of you for doing that right now. After the break, families in Connecticut are struggling to find care following the closure of 2 hospital-based gender-affirming care programs. You'll want to hear this. We'll hear why these programs were shuttered and where families are turning for help. Stick with us. You're listening to The Wheelhouse. This is The Wheelhouse from Connecticut Public Radio. I'm Frankie Graziano. 2 hospital-based gender-affirming care programs in Connecticut recently closed, leaving families across the state scrambling. Sujata Srinivasan has the story. Sujata is senior health reporter at Connecticut Public. She joins us in the studio now. My bestie, Sujata, thank you so much for being here.
Morning, Frankie.
Are you worried about you or your loved one's access to gender-affirming care? We know many people are. Let us know. Give us a call, 888-720-9677, 888-720-9677. Leave us a comment on YouTube as well as you're watching, youtube.com/Connecticut Public. Connecticut was a place where children, teens, and adults could seek gender-affirming care before this year, right? Sujata, what kind of happened to change that?
So, Frankie, it began in January, the very first day that President Trump took office. He issued an executive order that the United States will recognize 2 genders only. And the U.S. would end federal support for what it called gender ideology. So it began with that. And then towards the end of January, there was another executive order issued to ban trans care, to limit federal support for trans care for kids, youth, under 19. So that went into effect. And that executive order had this language. It said It described the medical treatment as chemical and surgical mutation, and that children were being maimed by doctors. And then in July, the U.S. Justice Department followed by issuing subpoenas to providers. And that very month, soon after, both of these hospitals you mentioned announced that they would be ending trans care for youth below the age of 19.
What impact did this action have on children or teens currently receiving their care at Connecticut Children's Hospital in Hartford?
I met families that are scrambling to get care. So they're looking at Boston. One family that I met with, they're looking at Boston. They have an appointment in Boston coming up in about a week. But just this morning, the Associated Press ran a story saying that a federal judge in Massachusetts blocked Trump administration's attempt to subpoena medical records of trans patients receiving care at Boston Children's Hospital. These are kids, and they're asking for personal records on the treatment, and that could identify, who these children are. So one of the parents I met told me that, and these are two mothers, Melissa and Heather, Melissa Combs and Heather Page. And she's the mother of Page is the mother of 11-year-old trans daughter who's now going to seek care from Yale to Boston. And then Melissa Combs, mother of a 18-year-old. And she says, I don't want the feds. She says, I want to be out of the reach of the feds. I want my kids to be out of the reach of the feds. And therefore, this kid is not going to see a doctor until she turns 19. And then, there's no way as of now for the feds to get her records. So she's stocked up on her hormone medication and is waiting to turn 19. That's what's going on.
Very difficult at that point, especially if you have something else going on. You want people to go to the doctor. That's why you have insurance, at least in theory, is you want people to be healthy. Your reporting on this topic brought you in contact with a young man named Daniel Human. Can you tell us about Daniel?
Daniel is 20 years old, and he's your 20-year-old boy who loves to bike, studying women's gender and sexuality studies at UConn, loves to travel, and is now in Edinburgh on this semester, and has become an advocate. So at the age of 7, he began transitioning. I met the whole family in Mansfield, and Dad said nothing happened at 7 other than the fact that Daniel changed his name and pronouns, and they tried hard, contrary to.
This was 13 years ago.
Yeah, so contrary to.
So name and pronouns. This wasn't just a woke thing that just happened last year. You're saying this was 13 years ago.
Years ago, after counseling. So this child received counseling for years. Every one of these, the parents that I met, told me that their child received, psychiatric and psychological counseling for years before even starting to transition. It was not something that happened overnight. So when Daniel transitioned, as a child, he would gravitate towards the men's section in the stores, refuse to play with certain toys. And, I always question, why we promote toys on a gender basis. But in this case, the parents told me that this was Daniel's choice. They tried really hard to make him conform to his birth gender, but it only made Daniel miserable and not thrive and not perform, to the point where he was at risk of dying by suicide, is what he said. And without this care, he said, what would have happened to me? It's the reason why I'm here.
Critics of gender-affirming care say it starts too early, but early intervention was life-altering in Daniel's case, as you just really shared with us. And here's what he shared with you. We actually get to hear Daniel's voice. Here it is.
After I transitioned at 7 and started puberty blockers at 9, when I got my testosterone shots, when I got top surgery, they are all the reason I'm here.
Yes. Yep. He spoke about how critical this was for him.
Can you expand on what we're hearing from there? You're saying it was critical, and that's kind of the point, is that this saved Daniel's life.
So, the question that parents are asking now is to remember, who are these people who should decide? It's the child, not on their own, the parents, and the doctors. And to what point does the federal government understand the medical needs of a child, is the question raised.
This regret that they're trying to talk about, this kind of transition regret, what are your sources? What is Daniel telling you about that? What are you hearing?
See, as journalists, we are open to all people with all experiences, and we listen and we witness their experience. And I've read several studies. One of the most well-known trans researcher who studies the transition, Kinnan Ross McKinnon, wrote in the New York Times recently in a longer piece in Substack that the data points, earlier pointed to about between 1 and 6% of transition regret, mostly in adult women who transition with full surgery. But later Scandinavian studies point to about 10%. But this is the takeaway. The takeaway is, rather than using this data to argue for bans, researchers stress it should be used to improve informed consent and patient support, not eliminate care, McKinnon wrote. And that seems to be the takeaway that I'm hearing from people, from researchers, from doctors.
Where are families in Connecticut seeking care now? Are there any facilities that remain committed to offering gender-affirming care in the area?
For children, it's Boston.
Yeah, not in Connecticut.
Not in Connecticut.
Is it Boston Children's Hospital? Is it Mass General? Where are people going?
Yeah, so all of these hospitals have announced their commitment to keep their doors open. And listen, it's a cost on the one hand. It's a cost factor. Hospitals are already crushed in Connecticut with lower Medicaid reimbursement rates, adjusted slightly, but again, not up to the cost of service. They continue to say, and now with the federal kind of a witch hunt, or as critics say, on trans care, the access to Medicaid funding is going to be questionable. Federally qualified health centers in Connecticut. I spoke to Sabrina Trokey, who is the CEO of Wheeler Clinic, and she says, look, we don't know how long and in what way we can continue gender-affirming care. It's also uncertain. So that uncertainty is there, even though Connecticut has shield laws, and Connecticut is a state where, unlike 27 other states that have banned or restricted in some way or form gender-affirming care, Connecticut offers that legal protection, but then the hospitals are under intense pressure.
A lot of concern that hospitals, that states are going to have to fall to that pressure from the federal government in order to keep some kind of funding there. I appreciate you bringing that up. But what's at stake, as you mentioned earlier, is it sounds like people like Daniel Human, their lives are on the line here. What are you following now, Sujata? We only got about 30 seconds left. Are you following any pending challenges to Trump's action? Any local legislation? What do you got?
Yeah, so our colleague Chris Polanski spoke with State Senator Matt Lesser, and we understand that the state lawmakers are trying to see what more can be done. And the state tried to pass additional protections earlier this year, but that did not go through. It did not get a floor vote. And, our colleague Michaela Savitt dug up some information on that. I'm going to be following up.
So pay attention to Michaela and Chris's and Sujata's reporting.
Yep.
Thank you so much, Sujata Srinivasan, Senior Health Reporter for Connecticut Public. So great to have you on the show.
Thank you, Frank.
And an important topic to continue to follow at ctpublic.org. Today's show produced by Chloe Wynn, edited by Patrick Scahill. It was directed and produced here by Eugene Amatruda and Joe Koss. Special thanks to Megan Fitzgerald, Connecticut Public's visuals team, and our ops staff. This is the Wheelhouse. Thank you for joining us this week.